AIDS Day. It serves as a crucial moment to reflect on the ongoing fight against HIV and AIDS. So as South Africa joins the global commemoration, it's important to reaffirm our commitment to placing human rights at the center of HIV care. Many in the sector would indicate so. This is essential in our collective effort to end AIDS as a public health threat. However, serious challenges remain, including ARV stockouts and low treatment adherence, which continue to hinder progress. So World AIDS Day is a powerful opportunity, would all agree, to strengthen that support for those living with HIV and raise awareness about the effective prevention methods and remembering those who've lost their lives due to the illness. Today, we're joined by experts to reflect on how far we've come and the challenges as well. Dr. Izukanji Sikazwe, who is the co-chair of the African-led HIV Control Working Group, will also be joined a little bit later on by Dr. Yogan Pillay, who is the director of HIV and TB Research at the Bill and Melinda Gates Foundation. And of course, both of them will be joining us quite shortly as well. In fact, I think Dr. Sikazwe is with us at the moment. All right, let's start with you, sir. So, of course, there was a report, I recall reading, that many people living with HIV indicate that they would prefer a longer treatment supply due to, amongst other things, long waiting times. Is this the current challenge that we're dealing with at the moment?
Good morning, and thank you so much for having me on the program on this World AIDS Day. And before I respond to your question, I really want us all to really remember where we're coming from and reflect a lot of the challenges that we've undergone and also the successes that we've been able to achieve in this space. And I think that will help us act in terms of what needs to be done. When you talk about challenges that are being faced right now and the need for more long-acting drugs to reduce the time that individuals are spending within clinics, yes, that is an urgent need. And we're grateful that the science has changed. We do have access to long-acting medications, but they're not readily available to our patients that need them right now.
Mm. And just back to what I had mentioned, Doctor, is that you have those that are on ARVs basically indicating that they want a longer treatment supply because there are a number of challenges, including long waiting times, for example, and the fact that access is also still a challenge. Could we address that issue?
Yes, access remains a challenge. And you have to remember that the vast majority of people now living with HIV are really leading healthy, normal lives, and having to go to a health facility to wait to be given drugs when you're essentially feeling well is a deterrent. It interferes with their day-to-day living experiences, their work-life expectations, and therefore being able to have access to drugs that, for instance, you only take once every month or once every 2 months would reduce on the barriers in terms of constantly going back to the health facility to access these drugs. But in as much as we have these drugs on the market, they're not readily available to the people that need them. They're not yet accessible for the vast majority of individuals living with HIV on the continent.
Yeah, is this why we're finding, Doctor, this particular challenge resulting in people not staying on treatment or even stopping treatment due to some of these concerns?
Correct. People will stop taking treatment because they just cannot get to the health facility, or they get to the health facility and they meet with challenges in terms of long wait times or healthcare providers that are really, really busy and cannot attend to their needs. And therefore, this really discourages them from coming back to the health facilities. But we're fortunate, like I said, that we do have these drugs like lenacapavir and long-acting cabotegravir that are there on the market. But it's just an issue of access. We need those drugs in our facilities, within our communities, and made accessible to those that want to switch over to these other drugs.
Yeah. Financing of the HIV response program going forward seems to be a hot topic at the moment, potentially because, we have a scenario where the US administration could reduce funding. Is that of concern at this particular stage?
It's been of concern for a number of years now. And as individuals working in this space and those most impacted by HIV, we have to remember that we're reliant on external funders or external donors in terms of securing our health. And it's just not securing our health as it relates to HIV, but across many diseases, including TB, or tuberculosis and malaria. And these, as you know, are the really high risk factors for morbidity and death on the continent. So our African governments have to do more in terms of securing funding within the continent to secure HIV prevention, care, and treatment services.
All right, Dr. Izukanji Sikazwe, thank you very much indeed. We're going to continue this conversation after the break as well. We're expecting, of course, Dr. Yogan Pillay, who's the Director of HIV and TB Research at the Bill and Melinda Gates Foundation. He'll join us just after the break. Please stay with us as we continue this discussion.